KEA Tutorials presents Classification of Mental Disorders. Mental disorders are classified in various ways in respects to the criterion involved. There are 6 categories of mental disorders under which all the other disorders fall. Mental disorders are classified under the following criteria. The first classification: neurotic disorders, which are mild form for which there's still contact with reality. The second, psychotic disorders, which are more severe and there's loss of contact with reality. The third, addiction, which can either be drug or alcohol. The fourth, mental retardation, which is an abnormal delay in mental and intellectual abilities and functioning. The fifth, personality disorders, which affects one personality, character and behavior. And lastly, sexual disorders, which are related to sexual gratification from some factors, which is the 6th classification. Under the first classification termed non-psychotic or neurotic disorders, the affected is still in contact with reality. Common conditions under this are anxiety disorders, neurotic depression, conversion disorders, and phobias. The second classification is that of psychotic disorders, which is characterized by loss of contact with reality. It can be split in 2 subclasses. The first, organic subclass, which occurs as a result of possible damage to an organ. This subclass can either be acute or chronic. The second subclass is the inorganic subclass. This can either be effective or non-effective based on whether the mood is involved or not. When the disorder is organic in nature, it means an organ damage is leading to this condition. Based on the timing of symptoms, it can be acute, when symptoms are short-lasting. A good example is delirium. It can also be chronic. Here, symptoms are long-lasting. A case like dementia is chronic. When these disorders are inorganic in nature, it means no organ is affected. Psychological, developmental and environmental factors are considered in this case. It can either be effective or non-effective, depending on whether or not your mood is affected. When it's effective, your mood is affected. This is typically seen in mania, characterized by excessive feeling of euphoria, or depression, characterized by sadness. When it's non-effective, the mood is intact. Common conditions under this are schizophrenia, paranoid illness, and schizoaffective disorder. Our third classification is termed addiction, which can either be alcohol-related or drug-related addiction. Our fourth classification is termed mental retardation, which is characterized by below-average intelligence or mental ability and a lack of skills necessary for day-to-day living. It is mostly noticed in individuals with an IQ below the average, which is 100. Our fifth classification is termed personality disorders. These are conditions which affect one's personality, character, and behavior. It is divided in 3 clusters, ranging from A to C. The first cluster, Cluster A, is made up of 3 disorders. These disorders are characterized by eccentric and odd behaviors. To remember this cluster, the mnemonic PSS should be kept in mind. The P stands for paranoid personality, marked by suspiciousness. The first S stands for schizoid personality, marked by social withdrawal. And the last S stands for schizotypal personality, marked by odd thinking, behavior and feeling coupled with magical thinking and illusions. The second cluster, Cluster B, is characterized by unpredictable behaviors. The mnemonic to remember is BON. The B stands for borderline personality, in which due to faulty parent-child relationship, a person is unable to exhibit trust for others. The A stands for antisocial personality, in which an individual exhibits reckless and impulsive behaviors towards others and has no regards for rules. The H stands for histrionic personality, characterized by dramatization and exaggeration of feelings. The N stands for narcissistic personality, in which a sense of grandiose of self is exhibited coupled with some episodes of inferiority. The third cluster, cluster C, which is characterized by anxiety and fear. The mnemonic to remember is ADO. The A stands for avoidant personality, which is characterized by avoidance of others and social withdrawal. The D stands for dependent personality, characterized by constant relying on others for decision-making, activities and others. And the O stands for obsessive-compulsive personality, which is characterized by over-preoccupation on efficiency and perfectionism, sometimes detrimental to the affected. And the last category, sexual disorders, which determine how due to certain factors, one gets sexual gratification. Common disorders are sadism, which is a disorder in which the affected experiences sexual arousal in response to the extreme pain, suffering or humiliation of others. Masochism, in which a person experiences sexual excitement from being humiliated, beaten, bound, or otherwise abused. And transvertism, in which a person experiences recurrent and intense sexual arousal, urges, and behavior from wearing clothes traditionally worn by a different gender. Thanks for watching. Don't forget to subscribe and smash the notification icon so that YouTube keeps you updated of our activities. See you in another video.